One of the things that our founder says, and it resonates with me, is in the future, people are going to look back at us and say, how could you have let 50% of your pregnancies be unplanned? And your solution was just adding more hormones to women who already couldn't tolerate it. What was wrong with you guys? So I think that's really is very telling of the future is going to be so different. I don't think we can imagine what it's going to be like to have a male contraceptive, several of them, in fact, because there are others in development on the market in the next 5 years. So 10 years from now, we may not even think that women should be involved in contraception. The tide may change. The other speaker in my panel last week was talking about men welcoming women into the wealth discussion. And I said, that's really ironic because now women are welcoming men into the contraceptive conversation. So I think it's going to be a very different world. I think, as we pointed out, I think the health of men is going to be greatly enhanced by what we're doing and getting men into doctors' offices earlier for more preventive testing.
Yeah, and it's as the more we're talking here, it's you're part of the men's health moonshot, but it's really also part of a women's health moonshot and the access to care moonshot and all sorts of other. It really has, I think, far-reaching implications here. So we're really grateful to have you as a health transformer in our community and to support what you're doing. And we just cannot wait for this to come to market.
Yeah, to start with, it will be urologists because they're seeing men right now. But a family practitioner who is interested in being trained would be a perfect person. And the other thing to think about is men in our demographic. If you look at that 18 to 49-year-old segment, they're really not seeing a doctor routinely for preventative medicine. We're being told this by the medical profession that they really are going to enjoy having men in earlier so they could do other preventive testing for things that we see on the rise, like prostate issues, different forms of colon cancer, et cetera. So I think it's going to have a major impact on men's health overall. It also helps the doctor. The doctor is going to have more patients coming in. As women, we start going to a gynecologist in our teens and then go every year. Men don't really see a urologist until much later if they have an issue. They have a prostate, kidney stones, or they want a vasectomy. So we're really, I think, expanding men's health in general, as well as contraception.
That's interesting. I could see now as a young man, you now go develop that relationship with the urologist at a much younger age. And then now that you've established that, that might prevent other types of health issues for men down the line because you're catching those early because you're educated, you have that relationship. I didn't even think of that. That's interesting.
No, it's very powerful. It's, as some people say, it's a movement.